Hello, viewers. We have met once again, and today on Patient Life Matters, we are going to talk about NMC Code of Conduct. And we started with prioritizing people, and today we are going to talk about how to practice effectively. How to practice effectively. That is what we are going to talk about today. So that by the time that we finish with this, you will know that if I'm practicing, how do I practice effectively? When you say practicing effectively, what is the meaning of it? When you talk about practicing effectively, we are talking about giving the right care to your patient. You give a right care to your patient in the right way, in the right manner, and keep very good communication. Some of us are professionals actually, but when we are working on our patients, even good communication becomes a problem. We can't communicate to our patient well. So even if you do not give good communication, it means you are not practicing effectively. Though you are practicing all right, but it is not effective. You need to make sure that the care that you are rendering is right and in the right way, so that you do not harm the patient, so that you do not abuse the patient, and keep a very good communication by talking to your patient as a human being. Any procedure that you are going to conduct, focus on the patient and talk to your patient very well. So in simple terms, we are saying always do your job correctly. Always do your job correctly. What the procedure manual has stipulated, follow it, put it down, read it, understand it, and then use it on your patients. And always do it to the best of your ability. Do the procedure or the care that you are rendering to your patient to the best of your own ability. What you think you can do. If you know that it is beyond you, please do not do it. And if it isn't beyond you and you can do it, do not underdo it. That is what you mean. Work or make sure that you are working what? You are practicing what? Effectively. Anything that you are doing in the world, any procedure that you are conducting on your patients, you make sure that you are what? You are practicing effectively. We are talking about keep your knowledge and skills up to date. There are some of us, we don't even go for trainings. We don't even go to school. We've been in the world for a very long time and we are always practicing the old things. We don't update our memory, sorry to say. We don't update it. And if we do not update it, we may not know the new things in the system. It could even be that how we serve patient food has been changed. You didn't know because you are not going for trainings. You are not going for workshops. All what we care for is doing what? Is always going to work and then doing the old things, doing the old procedures, and then the month will end and then we get our pay. That is what we are doing now. We need to update ourselves. That is the reason why always we come here to teach you. We come here to refresh your memory, to bring certain things back into life in you, in your mind, so that you can update your system. So the skills that you have, we are not saying it is not good. Your skills is good, all right. You are all very amazing workers out there, and I love healthcare professionals. They are doing amazing things, because they act like God. They act like a savior. They are saving a lot of people's life, and we all clap for you. I and patients that we come there, we are clapping for you because you're doing very well. Your job is not an easy job. Your tasks are not an easy task. But all what you are saying is that at least once a while, go and update it. Go and update that knowledge. Even if it is not an update, pick a book and read. Pick anatomy and physiology book and read. Pick ops and gynec book and read. Not necessarily you are working in pediatric ward because of that you don't care about mental health nursing. No, make sure that you are updating yourself in the system. Always the skills that you have, the knowledge that you have, make sure that you are updating it. When you talk about practice effectively, we are talking about following policies. Every organization, every hospital, every institution have certain policies that they have designed. We need to follow them. You need to follow the policies, because if you do not follow them, you are going to put patient care into jeopardy. There may be a problem. So we need to make sure that all the policies that they have designed, the guidelines, and even the care plans that they have drawn for the patient, we are following them. And if you follow them, then it means you are practicing effectively. And we need to work well in a team. There are some healthcare professionals, when they are in a team, they make the work become very difficult. There are some people, they come to work to make the work become very difficult. I bet you that when you go to other hospitals, you will see a certain team, and when you engage them, they will tell you that there are some people, when they come to work, even if the task that they are going to do is not difficult, that person will make it very difficult for them. And there are some people too, when you are working with them, you could feel that even if the task is difficult, it will become easy for you. Some people are very difficult in hospitals, and they make the job become very, very difficult. Please, if we are practicing effectively, it means when we are among a team, we are helping the team, we communicate well, we coexist well, we work well, we don't come to work with laziness. We try as much as possible to put everything aside and then work well, work with the team, communicate with your members. Even if you're the leader of the team, if you're a subordinate of the team, report whatever that you see, communicate very well, and it will show that yes, you are working or you are practicing effectively. We need to document whatever that we do as healthcare professionals. If it is not written, it is not done, as our slogan. So anything that you do, if you do not put it down, it means you haven't done it. And when we are documenting, we need to make sure that we are documenting accurately and clearly. We need to make sure that when somebody comes to pick our script or our report to read, the person will understand and the person can act on it effectively. That is what we are talking about. That anytime that we are documenting, the documentation, we will do it. But when we are doing it, let us do it well. Anything that we saw, what we have done, what we even didn't do, the new things that we have seen, even changes in patient behavior. A certain pressure source that were not there, certain wound that were not there, that has not been reported earlier. When you see it, please report it. And when you are writing it, write it clearly and accurately. When the patient says something to you, please report it as the patient said to you. Do not attach your words to it. When you do this, it means or it shows that you are practicing effectively. And ask for help. Ask for help too. Do not think that you know all. No, make sure that you are asking for help. When you see that you are unsure, you don't know, you are reading a certain prescription and you can't see well whether it is metronidazole or it is whatever, call somebody to come and help you, because sometimes our doctors do write in a certain way that we can't even differentiate between them, their words. So when you find something like that, please call someone. When they give you a certain task and you don't know how to go about it, please ask someone. Call your seniors, call your supervisors, your managers to come and help you. Don't take it as if you know everything, so you can be an island. You don't want to ask anyone anything. No, do not do that. If you really know what you're doing, then yes, a hand of applause for you. You're doing very well. But if you do not know and you are unsure, you have even a little doubt, please do not hesitate to go and seek for what? And seek for help. And everybody is willing to help. If you're in a team, everybody is willing to help. So go and seek for help. So when you talk about practicing effectively, we are talking about an example like checking prescriptions very carefully, checking them very, very carefully. We have the right time. Is the right time? Is that medication that you are going to administer? Is it within the right time? The medication that you are going to administer, even the prescription, is it valid? Is it clear? The doctor's signature, is it there? The doctor's name, is it there? The blip number, is it there? You need to check to see if it is valid. The medication that you are going to administer, can the patient tolerate it? A patient who cannot swallow, and you are going to give what? Oral medication. You need to assess that. Can the patient even tolerate it? Do you get it? The right doses, the amount that you are administering. Is it the right dose for the patient? Look at the patient weight. Check it again. You are giving paracetamol. The patient weight is less than 50. What do you need to do? If you administer medication, or if you observe or you check the prescription carefully, you are not going to make mistakes in your job. And that is what we are talking about. We can, example, when we say we are practicing effectively, it means even when you are handing over, you have to hand over clearly. At a shift, when you are changing your shifts and you are handing over, you have a certain tool that we have designed that you use in handing over, which is called S-bar. We need to know it, and very soon we shall learn S-bar for you to know when you are using S-bar to do handing over, what do you have to say? So you need to hand over clearly. Tell the incoming staff what you have done and what you haven't done. Always, that is what, as a healthcare professional, you need to do. You need to make accurate notes after every observation. All these are examples when it comes to practicing effectively. So when you talk about practicing effectively, this is what NMC means. And this one is the second code of conduct of NMC. Today, we are going to end here. We shall continue next time. As you always say, patient life matters. When you come on it, first thing you need to do is to subscribe to it, share to your colleagues, so that at least everybody can work as professional as possible. Not you alone, but I myself. I'll end here and I say bye-bye.